Hello, my name is Heather Tillewein. I'm an assistant professor at Austin Peay State University, and this is my presentation, Implications for Female Same-Sex Couples and HIV. I worked on this manuscript with Nicolle. It's been published in the HPHR Journal, so you can go check that out. And we also won the Next Public Health Generation Award during this competition we were in, and we got third place for this study. So I will begin. So a little bit of background about HIV and females who have sex, women who have sex with women. So we have about 9 million adults that identify as lesbian, gay, or bisexual, 19 million Americans engage in same-sex behavior, leaving 646,000 same-sex couples and 54% of them being female. So 89% of women report having intercourse without using a condom. And we only have 6 known cases of women to women transmission of HIV. And normally how this transmission happens between 2 women partners is they're infected with HIV by either having a bisexual partner, using sex toys, if they're using sex toys too rough, and blood is created. So that could happen as well. And exchanging blood in any form during sex can cause you to transmit HIV. Also, women often do not disclose HIV status to female sex partners due to shame. So because they either had sex with a man or there's just a shame for having HIV in general, they may not disclose it to their female partner. We have little data on female-to-female transmission of HIV. Like I said, because of them not disclosing their status and having the shame, they may not go get tested for HIV. So with that, many believe that women having sex with women has no risk of contracting HIV, which leads to women from abstaining from having same-sex practices, also from medical providers from even discussing with female patients that they could be at risk for HIV or transmitting HIV if they do have sex with another female. So we have a lack of education on HIV prevention strategies, inconsistent or unsafe sex with men and women. And like I said, medical providers just not having that education background on HIV, especially when it comes to women who have sex with women. Most medical and health services have a heteronormative narrative, so they're really uninformed that women can be susceptible to HIV. And so they may not inform their patients about having safe sex if they are having sex with women or just in general. So with that, with HIV, we have 34,800 new cases that happened in 2019. Out of those, 70% were gay or bisexual men. In 2018, there were 36,400 new HIV cases, and out of those, we had 18% that were women. When compared to white women, we have Black women and Latinas having higher rates of newly diagnosed HIV infections, and they were 3 times higher. Black women were 15 times higher than white women, and Latinas were 3 times higher than white women to contract be newly diagnosed with HIV. While we have less of 1% of our diagnosis of HIV infection found with women who have sex with women, like I said, on record, we do know that we've had 6 cases of that occurring, most from blood exposure during sexual intercourse after sharing sex toys. In 2019, for every 100 women who've been diagnosed with HIV, 76 received HIV care, 58 kept with regular HIV care, and 64 were virally suppressed. So we still have a group of women that are not receiving any kind of HIV care at all, or even regular care in general. And so that's definitely an alarming thing and what this presentation focuses on. So for our intervention to combat this lack of education with women who have sex with women, combat this belief that women cannot get HIV and women who have sex with women can't transmit HIV, we recommend adopting a comprehensive sex education program. We also want that education program to focus on women who have sex with women, focusing on how they can have safe sex, how they can use sex toys safely with their partners. Definitely advocating for the use of condoms when using sex toys and what could happen if you exchange blood during any kind of sexual activity. We also educate them on the risks of HIV transmission with intravenous drug use. And then we would discuss that women with sex with women can participate in sexual activities with males. And so if they are having sex with women, they may also have male partners that they're having sex with and can get HIV that way. We definitely promote a woman who has sex with women multimedia campaign. No one ever focuses on this, which is why we are here advocating for this today. We want to discuss safe sex behaviors amongst women who have sex with women. We want to have rideshare, social media, television, radio, all campaigning for this kind of sex education on women who have sex with women. And we definitely want the poster child or the people representing this to be women that do have sex with women, so they can advocate and peer educate other women as well on the risks of having unprotected sex, intravenous drug use, risks with sex toys, and blood exchange. So that's very important to promote it. And then we also would advocate on certain AIDS and HIV awareness days. So we have a list of days that we would target our media campaigns, such as National Minority Health Month, National Women's Health Week, Women's Health Month, World AIDS Day, and HIV/AIDS Awareness Month in December. For that, with the ride shares and everything, we would have these educational pamphlets on HIV and safe sex education. And in these pamphlets, we'd educate how HIV can be transmitted during female same-sex activities and ways that they are able to prevent HIV when they are being sexually active with other women. And then we'd also provide statistics on female same-sex transmission with HIV. Like I said, we only know 6 known cases of this occurring. But obviously, if we promote safe sex and getting tested, then maybe more women who have sex with women, our rates may go up. If we see that that has been occurring and just people have not been getting tested. So that would be one of the goals, is to finally get a kind of true estimate on what the prevalence is of women who have sex with women and transmitting HIV. We would also partner with Planned Parenthood, breast cancer centers, or breast centers, gynecologist offices, clinics, gay bars, sex toy shops, tattoo parlors, in order to target these women who have sex with women and provide more information on HIV transmission. For rideshare companies and for drivers, we provide pamphlets on HIV and the prevention of HIV for women who have sex with women. So not only will it help educate riders on HIV prevention, but hopefully we'll target our women who have sex with women as well, making sure that that piece is in there to make it, to advocate for that knowledge to be passed around. Because like I said earlier, a lot of people don't even know that women who have sex with women can transmit HIV. So getting the word out there and advocating for that is super important. And the reason why we chose rideshare companies is because in 2020, they already did 12.5 million individuals use Lyft services and 118 used Uber. So that's a lot of population you could target with just these media campaigns in rideshare companies. In 2013, Uber did partner with the company L to distribute condoms through Pride Week. So they are aware of STIs and HIV and how to promote safe sex. So we would just partner with them again, hopefully, to advocate for this to come out. We'd also target metropolitan areas, so majorly urban centers, major cities, East Coast, West Coast, and South Coast, and little small towns in the South, because that's where we really see HIV residing in. California, New York, Florida, Texas, and Georgia would have the largest number of people living with HIV. So we definitely would target those states. And that's based on 2019, they were the largest. And then here's some of what our ads would look like. So all about promoting HIV, how you can get HIV, know your status, having these days be aware, providing free tests. And then on the left of the screen, you can see women can get HIV too. So really targeting that message, like, hey, women that have sex with women, you can get HIV, or just women in general, you can get HIV. Spread that awareness and advocate for it. There's also a QR code that people can scan. And when they scan it, it points them to the nearest testing center so they can get tested for HIV and other STIs while they're there. And then we also provided some information of how we are seeing women who have sex with women are transmitting STIs and HIV, such as blood exchange during sexual activities, using condoms during their sex toys, anything to help them reduce their risk. So we're going to use various media strategies while partnering with these other organizations and developing these partnerships to increase awareness about women who have sex with women and HIV transmission. And it also will help the general public aware that it is an issue, and just help the general public have knowledge on HIV prevention as well. And ultimately our goal would be to reduce the HIV stigma amongst these communities, especially for the community of women who have sex with women. And how we would evaluate this program to see if it was effective or its intervention is a number of rideshare informational pamphlets and stickers that were taken, and then we'd see if the prevalence of HIV cases in the area as a whole has reduced. Also, we'd see if the number of women who have sex with women at testing centers increase. That means they are going out and getting tested. Whether that shows a higher prevalence of HIV amongst that community, we have yet to determine that. But further research definitely can. All right, and that is the end of my presentation.